ever since COVID took over our lives, we seem to think as a nation of pill poppers that the 500 strength paracetamol or Dolo will not help. It is only Dolo, 650, that will help. And therefore, anything happens, as I said. We pop a Dolo in any case. There is WhatsApp University and there are medical colleges running on WhatsApp universities as well. So everyone will self-diagnose. Go to Google, put your symptoms. Usually it will say take a paracetamol or a Dolo and we go along with it. So is it fair to blame the medicine when it is patient behavior and consumer behavior that really is the problem?
Good evening. So I think in India, every human being is born with a medical degree at birth because we self-medicate and we abuse and overuse medications. And the most common ones are the painkillers, what we call as antipyretics or NSAIDs. And the other group of drugs is the antibiotics. But focusing on paracetamol, I think this is full compliments actually to the company of who's manufactured Dolo, because it's a marketing strategy to the globe. They have marketed it to demarcate between fever and high fever. Therefore, they have said indirectly not 500 but 650 milligrams. Second is they marketed it that it is very good for pyrexia of unknown origins, fevers of unknown origin. Third is, of course, it's a very different looking tablet than paracetamol, easily to swallow. And if you really look at the Indian mythology, Dolo means take twice. So it's actually a mime which has a mental recall. But any drug which is taken in excess or excess doses or over a period of time can cause harm. It's important to understand that paracetamol is a sufficient drug for fever or pain, but it is not as strong as other NSAIDs. Our aim is to diagnose the cause of fever and not worry about the fever too much as an isolated entity. Long-term use or even sporadic high-dose use of paracetamol can cause anemia, can cause GI bleeding, can cause acute abdominal symptoms, damage the liver, damage the kidney, increase the risk of cancers. And very importantly, we've seen cases even in children who come with acute reactions called as Stevens-Johnson syndrome and other toxic manifestations which are indeed life-threatening. We've also seen this being overused in pregnancy, where there is a direct link between overuse of paracetamol and children being born with autistic disorders. So I think there is a word of caution. Over-the-counter and online procurement of medication has actually ruined the game. But I think we need to drive home the point that every medicine which is taken has certain side effects, has certain doses, has a bandwidth. The commonest problem which I've seen in my group of patients is they want instant relief of fever. Crocin starts acting after 45 to 50 minutes. The duration of span of treatment is short. That means you have to give it every 4 to 6 hourly. There is an upper limit of dose. In children, it is 15 milligrams per kilogram per dose. In adults, it shouldn't exceed more than 3 to 4 grams in a day. But more importantly is, if you give a lower dose and then again a lower dose at short intervals, it doesn't act. It is dose dependent because of its protein binding ability. So you have to give the adequate dose in adequate duration intervals. Therefore, WhatsApp universities, homemade doctors, home remedies is absolutely wrong. And I have seen adolescents carry this with the pantoprazole before they go for parties. That's havoc. I mean, you're self-medicating yourself almost every day. Over to you.